Hello, ladies and gentlemen. So this video is about measles outbreak, and the measles has gained momentum in the U.S. in the 21st century. And so this article is talking about how the number of reported measles cases in the U.S. has surpassed any since the previous. Okay, so let me get back on that. Sorry about that. Trying to go back to where I was. Now where I saw this article, it was in USA Today, and I believe it's in other. It may be in other media. I'm sure it is. So I think it had a lot of in this article, it had a lot of ads. So this is one of those funny articles where it has a lot of ads that pop up. So sorry for that. So the number of reported cases of measles in the U.S. has surpassed any previous annual total this century. So less than 4 months into 2019, another rash of measles cases, mostly concentrated in New York City, have raised this year's figure to, I said fear because people are afraid because apparently even LAX here in the California area, there was a reported case of someone who had possibly exposed some people to measles. So going back to the article, it says that the figure to about 695, the U.S. Center for Disease Control and Prevention has reported this. So that's the figure that it has raised to this year. So the previous highest total in 2000, since 2000, when measles was declared eliminated in the country, had been 667 in 2014. So at no other point in the century had the amount climbed to 400. So health officials have warned the longer the outbreak continues, the greater the chance that the measles will again become entrenched in the US. So the CDC has tallied 626 cases for the year in its weekly report, which gets updated on Mondays in New York's health officials said on Wednesday. So this is really becoming a problem. And it has to do, I hate to say this, and I'm not trying to be mean about this because I know some people are sensitive about the subject of anti vaccine. So I believe it has to do with the anti vaxxers. Unfortunately, it has a lot to do with that. And so, some people are very passionate about not getting vaccinated for whatever their beliefs or their political views. And so the cases have grown over a course of, you know, several years since 2000. So it's gaining a lot of momentum. Um, and so I don't know what's going to happen. It just looks like things are getting really, really, really crazy right now when it comes to the measles outbreak. So it goes on to say that previous highest total since 2000, when the measles was declared eliminated, that's when it was declared eliminated. So the country had been 667 in 2014. So at no other point in the century had the amount climbed to 400. Health officials warned that the longer this outbreak continues, it is a greater chance that the measles will again become entrenched in the U.S. So the CDC has tallied 626 cases for the year in its weekly report, which gets updated Mondays in New York's health officials said on Wednesday. So another 61 cases were confirmed since last week, pushing the national figure closer to a 700 mark, which is very scary and making this the worst year for measles since 1994. So when there were only 963 instances. And so this has become really, it's getting to the point to where it's out of control. or it's going to get out of control. So, probably the number one factor we have to fight is misinformation. So, this concept some people have that vaccines are dangerous. And so, like I said, the anti vaxxer movement has something to do with this, I'm sure. So, it said that Judd Holtquist, assistant professor of infectious disease at Northwestern University Feinberg School of Medicine, the massive vaccine now, or the measles vaccine, now administered along with the immunization for mumps and rubella, is regarded by the public practitioners as safe and highly effective. So it provides 93% protection after a first dose. So recommended between 12 and 15 months of age, the 97% protection after a second shot between ages 4 to 6 years old. Okay, so let's go on further. So about 3/4 of this year's illness in the US have been in New York State, mainly in two ultra Orthodox Jewish communities in Brooklyn and in suburban Rockland County, which declared the state of emergency and barred unvaccinated minors from the public places in late March. So the order was later blocked in court. So it goes on to say, and I'm looking at this as I'm reading at the same time. It's just scary that these are things that supposedly they had cures and we weren't really supposed to be worrying about this stuff anymore. But we're worrying about this stuff all over again. So I think I maybe have jumped the gun. Okay, yeah. So let me go back down a little bit. Okay, so just I feel like like things are getting like really out of control where people are the things they should be afraid of, they're not really in fear of, and things that they're afraid of, there's really not much to fear, and they're putting themselves in harm's way even more so. So it goes on to say about 3/4 of the year's illnesses in the US have been in New York State, mainly in two ultra Orthodox Jewish communities in Brooklyn and the suburban Rockland County, which declared a state of emergency and barred unvaccinated minors from public places in late March. So the order was later blocked in court. So the ultra Orthodox rabbis generally have no religious objection to vaccines and have urged their followers to get inoculated. But the anti vaxxer movement has made inroads among the ultra Orthodox, even though they have little exposure to the internet. And so the CDC said that measles cases have been reported in 22 states this year, with outbreaks defined as three or more instances in 6 states. So measles is highly contagious and can spread through coughing, sneezing, and someone who is not immune can become infected after coming in contact with a contaminated surface or airspace where the virus can last up to about 2 hours. So that's pretty serious. And so there's there was also something I heard where they were stating that someone had arrived in LAX, and they said that this person had the measles, and they were warning people who had traveled during that certain period, if they were having specific symptoms, that they needed to get checked because they could have been exposed to the measles. And so that's how serious this whole thing is. It's not a game. And so unfortunately, we have people who think that this is, it's not enough to be worried about, but it really is. And so the growing measles outbreak is starting to get, really um, crazy. So Megan McCain is blasting the anti-vaxxer movement. So I think you heard that. If you hadn't, she is. She's not very happy about the whole movement. And so it says that the outbreak has caused parents to wonder, is my child protected? So a lot of parents are worried, so they're getting their kids inoculated or checking to see if their kid is inoculated properly so that if they happen to come in contact with someone who's infected or children who haven't been vaccinated, that their kids are safe. So the CDC said that measles cases had been reported in 22 states this year, with outbreaks defined as three or more instances in 6 states. So measles is highly contagious and can spread through, like I said, coughing and sneezing. Someone who is not immune can be affected after coming in contact with a contaminated surface or airspace where the virus can last up to 2 hours. That's a long time for some to cough and sneeze and something just be sitting there for 2 hours. Anybody can walk through there. So the symptoms of the disease, which has no cure, you guys, there's no cure for it, may take a week or two to appear, including a high fever, a cough, a runny nose, red eyes, followed by a rash that starts in the face and spreads to other parts of the body. And in some cases, the illness can lead to pneumonia and dehydration. So this is pretty serious here. So, unvaccinated children in impoverished countries are most vulnerable to the harshest effects of measles, which killed 110,000 people as recently as 2017. So, most of them were under the age of 5 years old, according to the World Health Organization, but adults can be susceptible as well. So, last week in Israel, flight attendant well into a coma. Okay. She fell into a coma after contracting measles and developing encephalitis. So, Nate, it's Nate Smith, director of Arkansas Department of Health, said the increased opposition of vaccines represents a significant public health concern because the disease they protect against are no longer being mostly imported by the occasional ill traveler. Okay. So we're seeing an actual transmission of cycles of measles here in the US. That's very concerning, Smith said. So the progress we made is basically build a wall of protection with immunization. Immunization has crumbled. And so that's sad that we have the wherewithal to eliminate something by vaccine, but because of the fear of medicines, that's pretty much the article, yeah. But because of the fear of medicines and the anti-vaxxer movement, is what they're saying is people with the fear of getting vaccinated is how this measles epidemic is becoming rampant. And so you see here, and this is out of this is George L. Ortiz, USA Today, published 6:24 p.m. So it's just really scary that here we are and we're in the 21st century and we have a lot of medical improvements, but we're battling old, from long ago diseases that we thought, we weren't going to be able to eliminate. We eliminated in the year 2000, and here now we're battling it more than ever before. And so with that being said, what do you think about the anti-vaxxer movement and all of these things that are going on? Is it just a lot of fear and things that we shouldn't be afraid of? Should there be more research into what is in the vaccine so that would bring some of the fear to rest? What should we do about this situation, or should it be a requirement before kids even enroll in school that they make sure that they've been vaccinated for specific diseases, even if they've already been vaccinated, to show proof that they've been vaccinated, which most schools do that, but to update their vaccination records to make sure that they have, because some, believe it or not, there's some vaccinations that you can get when you're a child, and as an adult, something happens and you don't show that it doesn't show that you're immune to certain things. And so You might have to be revaccinated for some things, some diseases. And so, they test you to find out if you show immunity. If you don't, then they revaccinate you. And so maybe they should start doing this. And now people working in places where a lot of people frequent, they work in child care centers or schools. That would be something of importance if they work in crowded places like restaurants or airports where there's all different walks of life, people. Um, those things would be important. Malls, shopping malls, places where there's lots of people. But even if you're not working in places like establishments, you could be in a place where it's very crowded. What about subways and buses and things like that? And so anybody could be susceptible to the measles at any given moment and not be aware of it. Now, my question is even if you're vaccinated, does that guarantee your safety if you do come in contact with someone who actually has the measles? So, having said that, I'm going to let this video go. Excuse me for all the ads. I guess this is one of those kind of USA Today. It has quite a bit of ads in there. But anyway, with that being said, until next time, think about that. What do you think about this whole issue? It's pretty scary because, two, I wanted to add, now I'm not saying this to be offensive or anything, but we have people that are coming from other places, and they may be coming from places where maybe they weren't vaccinated properly, or they didn't get shots, or they couldn't afford to get shots. Maybe there was a fee wherever they lived, or they didn't have proper medical care. And so if they come to this country, we have this problem with homelessness, and then we have this problem here. If they come to the US, we have a lot of people coming from other countries that are undocumented or they're homeless, um, and they have nowhere else to go. What happens with that situation when some of those people come in contact with people and become infected? Or will some of those people have the disease and come and actually spread more of the measles if they become in contact with someone who is sick with it, simply because of a lack of poor health care? So, with that being said, those are things to think about and consider, because these are some real issues that could very well change the face of what is going on in this world today. Since this disease is growing so much momentum, could these people expose this to people who don't have proper health care? So, with that being said, I'm going to let this video go. Two, I wanted to add something before I go. A lot of times people won't go to the doctor, not because they don't want to be checked too. If they're in a situation where they feel like they're going to be arrested or they're going to be apprehended by ICE because they're undocumented, they may not want to go to a physician to seek health care simply because of fear of deportation. And so these are some real issues that I think might be of concern, because if this person is sick or they come in contact with someone who is sick, they may have a fear that if they go to a physician that they'll have to present documents showing who they are and where they're from. And because a lot of times in clinics and in medical facilities, they want you to fill out forms, your first and last name, and they want to know your address and your birth date and personal information about you. And how can you fill out a form without mentioning the fact that you're not a US citizen, because they ask you to present medical cards and whatnot not. And if you don't have those things, if you can't produce those things, then what? So there's got to be some kind of plan in place for people who are not able, and homeless people as well, who maybe they're here and they just don't know which way to go and where to get revaccinated or get kids vaccinated. So I'm just, throwing some issues out, some things and scenarios out that could possibly happen. But anyway, with that being said, I'm going to let this video go. Like, comment, subscribe, and thanks for listening.